video.
Sorry, you guys are like super close. I look geeked right now with the bonnet and all, but it's not too bad, to be honest. Like, I didn't. It's a little tense. So if you're a skinny girl like me, you can definitely get this. Just make sure you're dedicated into gaining weight, because that's the key factor, as well as maintaining the fat. You don't want to lose the fat. You want to just make sure you get bigger, because we want to be big body Bens out here. Oh, but I appreciate the girlies right now. She's literally holding my hand this whole time. But that one's getting kind of hurting.
So we're getting nice and thin over here. They have the belly button, just taking the deep breath.
Yeah, so I'll show you guys what the gig is with the body right now.
Does the BBL help fill out hip dips as well?
Yes, it does.
Yes, please, you guys, ask any questions you want.
We're going to demonstrate that very nicely on Jazlynn here. Because that's the main part of where she wants us to focus.
Yeah.
So it's going to be the hip dips that get most of the volume.
Yes, like, all we need is a little picture. I want to walk a little bit, you know, pussy front, and have the hourglass figure. That's all she's trying to look for. And I'm going to be, you know, recovering for a few 4 months, but maybe October it's going to get bigger, because I'm going to not stop eating, girl. She's not. But get them to do what they're doing for me.
How long does this procedure take?
This procedure takes about 90 minutes to 2 hours.
Do you guys recommend a BBL for men?
Yeah.
We don't recommend the BBL for men, but we do them. If you're looking to get a, you know, a more rounded appearance in buttock, we have a lot of men who come in and have BBLs done with us.
Oh, because Jazlynn just got lipo. That's why I was going to say. I was like, oh, you got a BBL too.
You guys can check out our Instagram. We have before and afters of male BBLs.
That's right.
We have some fan pages that you can follow if you're a male considering a BBL. The procedure works very nicely, males and females.
I'm 118 pounds. How much would I have to gain to get this?
It depends on your height,
Yeah, because I was
but probably somewhere in the 130s, mid 130s would probably be a good goal. Obviously, the more weight you gain, the more fat we can take out. That's always something to keep in mind if you're on the thin side.
Oh, these rib bones in that implant, girl.
Is coughing dangerous when you're awake?
No.
And so if you guys have any questions, ask right now during this live stream. I'm saving this onto my IGTV, so you guys don't have to worry. And I'm doing the 5-part series. Part 1 is already up on my channel, so you guys are going to get a lot of content. I definitely didn't upload. I saved my, I saved,
Yeah. What is the best way to gain weight?
Just eating healthy fats.
yeah, and I use a
Good
petamin, which is not it's not legal, but
I think it is. No, it is legal. It's just
SCA.
I think it's just a naturally occurring amino acid. I think.
Okay. Well, I had 3 bottles of petamin, and that's pretty much it. That's how I gained weight. I talk about it all in the part 1 of the series.
Can minors get a BBL?
With parental consent, yes.
Dang, that's crazy. Okay.
Not without a parental consent.
Can you etch out a 6-pack?
Yes.
I'm 5'3", 195. Do I have to lose weight? It depends on the procedure. you're interested in.
It really does depend on the procedure. If you're looking to get a BBL, you might have to drop about maybe, 10, 15 pounds. Get you to, BMI around 30 is the ideal BMI for this procedure. Could be a little higher, could be a little bit lower, but near or around 30 is really ideal.
Age for a minor is considered 18 and under, right?
18 is not a minor.
I mean 17.
Yeah, I think 18 is considered adult, I believe.
Yeah.
It's also different by every state, but I think 18 is everybody agrees with that.
Yeah, I took hormones when I was 17, and then right when I hit 18, I was like, I'm looking this way.
For
Feel okay?
Yes, I'm doing well.
Good.
It's just around that belly button area. I'm kind of like,
Yeah.
So for pricing, you can call our office or fill out a free e-consult. We're pinned, so everything you need is in the link in our bio.
yes, what can we have?
Can you do a BBL if you're skinny?
I'm skinny, girl. I started my surgery at 104. Now I'm basically 132, 133. 142, 143 about. I'm gonna eat tonight. Can I eat tonight or just drink like?
Of course.
If you're 16, you can get one with consent.
With parental consent, yes.
Yeah, no.
Can you get a nose job and a BBL at the same time?
You get a BBL and a nose job at the same time. You can. I wouldn't recommend it because you really need to kind of be sleeping on your stomach, and that might be hard after with a nose job. You can sleep on your back if you want to get a nose job, a rhinoplasty at the same time. So it is possible. We've never had that request before, but it is possible.
Someone said, talk about what to do also to recover.
The recovery process is really, really important. Honestly, it's as important, if not more important than the surgeon and the surgery itself.
And then I wanted to know.
You need a lot of massages. You need a lot of good compression.
And then what was I saying?
After the BBL, is the belly button gonna change?
No.
Okay, perfect. All I want is my little boy abs. Remember I was showing you?
Yeah. No, the belly button doesn't change after this procedure.
Hi, where are you guys located?
We're in New York City.
But like, I was wondering because I had like crazy crazy abs before like I started gaining weight. Is there any way you guys can like attempt to do sketching if it's not like too hard? Because I love my muscles. I want to look like a workout girl, like not too fit up. Yeah, obviously,
It's already starting to come out. You can see the definition.
Yeah.
Okay.
A lot of your viewers say that you're snatched.
Oh my god, y'all are crazy.
Are massages optional?
No.
No.
No, massages are not optional because your results will not be optimal without massages.
Yeah.
So you wouldn't want to do that to yourself. It's not just about having the surgery and going home. There really is a very important part in the post-operative period that needs to be done for good results. Otherwise, you open yourself up to things like fibrosis. You can have fluid collections, seroma collections, all not good things that can affect your results.
Yeah.
So we really don't want you to think about the massages as optional. I mean, this is America. You don't have to do anything, but it is highly, highly recommended that you do good post-op care.
Does lipo leave scars?
Very little scars. So you can see that she only has very small little scars, very low down, that will be covered. And then once those little holes basically close up, they'll look like tiny little dots. So the scarring is very minimal.
Okay. Oh, that's like kind of rude.
All right, because I think what happened is we're pretty good. Your stomach is very nice and flat right now. And what we're gonna do is like we did before when you were on your side, we're gonna turn you on your side again to numb you. I'm sorry, to lipo those areas, okay?
Okay.
All right, so just let's turn the camera away for a second. Turn to me this way.
Hi.
This way.
Okay.
Mm-hmm.
Give me a second, y'all. Y'all can't get the goodies just yet. Sideways, like.
Can she sit on her butt afterwards, or when can she start to sit on it?
We recommend about 2 to 3 weeks of not putting pressure on the buttock, and then it should not be a problem.
Mm-hmm.
Oh my God! So what are we about to do now?
No, stay right there. No, not too much. Come down a little. Good, excellent. Good. So now we're just gonna go ahead and do, and then bring this arm up. Now we're just gonna go ahead and do the sides and the back. Okay.
Let me fix
So let's
that
fix
up
this
for you.
up. All right. Good.
Do belly button piercing
this
scars cause issues when going through the belly
Put your
button?
hands up. Put your hands up. It's covered. Everything's covered.
Put the shoulder back.
Good. I'm sorry. What was the question?
Do belly button piercing scars cause issues when going through the belly button?
No.
Can I say hi to them real quick?
No issues.
Yeah.
Hi guys. It's not literally painful at all. They literally know what they're doing. They know I'm doing really good. The main pain I did was just, poking the, was the poke of the numbing and, sorry, I mess up sometimes. And, oh wait, could you do it sideways by any chance?
Like this?
Yeah, sorry. So we're currently in surgery with Dr. David. He is putting in work like ASAP Ferg. I'm still awake. I'm surprised I haven't, got drowsy or anything. And I asked him right now if I wanted some. I don't even remember what I asked.
That's a lot of questions.
Yeah.
Yeah. So if you guys have any questions, just make sure to ask right now because they're all here. They know all the answers. So you guys can spam the comments. Make sure to spam the gram once I start posting. But these girls out here are truly a blessing. And Dr. David is honestly phenomenal. He is the sweetest. Because he definitely didn't have to wait for me. And I'm so sorry that things got rescheduled. It was just a mess because I booked my ticket, hotel, and everything, and then I got a little cold off.
So we do have another question. Can you get a breast augmentation and a BBL at once?
Yes, you can. We've done that many times.
Oh my gosh.
It takes some maneuvering on how to sleep because you can't sleep on your chest. But yes, we do BBLs and breast augments at the same time.
Yeah, you can't move your arms. You can't be walking around like that.
You guys can see her waist is really, really starting to show.
Oh
You got some really nice definition.
Yes, because I was very skinny. I was like I said, I was like 104.
Beautiful. Really, really nice.
Why couldn't she smoke weed before the surgery? Does weed have a negative effect?
Yeah, I had it. That was like my main question
The
because
truth is, I don't have a 100% straightforward answer. I think any kind of toxin before surgery, alcohol, marijuana, although marijuana does have some pretty good medical benefits. However, I'm not sure what it can do if you're trying to heal from surgery. And then obviously nicotine, which is the absolute worst.
yeah.
We won't operate on you if you're a smoker because the fat grafting won't take, the incisions usually don't heal. So we like people to be off of, all substances. Another thing that we tell patients to come off of if they're on it is birth control before surgery because birth control can increase your chances of having a blood clot. Straighten out your legs for me. Good, excellent. Oh, perfect. So it's in general, don't worry, everything's covered. In general, we just like you to be off of any and all substances.
Sides.
That's just the easiest way.
And also, you never know if your weed has nicotine in it.
That's true.
So bad.
Marijuana can be laced with certain things. You never know. And so it's always just better to be safe.
Yeah.
And overly cautious than underly cautious.
Yeah.
For smokers, cigarettes, how long do you recommend quitting before the surgery?
At least a month, if not longer.
Okay. So what is this? My arm?
But at least 4 weeks.
On your back.
Oh, this side feels way better. Maybe because it's flat.
Where are we doing the fat transfer? Hips and the butt?
No, I don't want my butt. I love my side profile of the butt. I know a lot of people won't agree with that, but I want to be able to walk outside and show myself, I'm definitely going to be like pussy something. I don't know if you guys like know that term, but it's where you fill your oats and, you know, get the gigs together and let the boys see what's good.
So we are doing a fat transfer to the hips.
And I gotta show you guys some of the TikToks that I got, because I knew you were telling me about the TikToks, so I made 2 of them right when I got home, even though look a mess because I was crying.
Can you take fat from the upper body, like armpits and shoulders?
That's what I was thinking. I
Armpits
was
and
gonna.
shoulders, and usually from the arms we can. From the upper back, let me just swing around this way for a second. I don't know, keep your arm up.
Do you have to quit HRT before surgery?
Yes. Yes. You have to be off of it before surgery. Because again, it increases your risk of developing a blood clot.
And that's really like a suction cup, right?
What's that?
That's really like a suction cup.
A what now? A what cup?
A suction cup.
What is that?
A bit of coconut. Oh my god, that's how you know I was just like tripping for a second. That's crazy. And tell me why I woke up at like 6. Like, no, like 5:59. That's why I was honestly 6:04.
Can you be awake during a nose job?
No, you cannot.
Yeah, no.
How?
Breast augmentations, rhinoplasties, tummy tucks, those types of procedures are all done asleep under anesthesia.
Yeah.
How long do you have to be off HRT before surgery?
About a month.
Yeah. Yeah, like right when I got my FFS, like just to get my surgery, I stopped transitioning. Like not transitioning medical-wise. Well, medical-wise I did stop, but I don't know. It's just too much. It's a lot of emotions. Like,
What if you had your bottom surgery already and have nothing to replace those hormones? Do you still have to come off HRT?
Yes, you do.
and the gig is, I have yet to get the bottom surgery.
I've been on the Depot birth control shot for a while. I only get it every 3 months. Is this included with the risk of blood clots?
So things like intra-uterine devices and depot shots are a little different than birth control. I think they use different hormones. So if you've had the depot shot, you can plan your surgery. If you have it coming up, we recommend that you not get it, or just wait and get it right after your procedure.
I gotta go see stuff here.
Can you get lipo in the face?
Yeah, we liposuction the chin, the jowls, the neck. Those are all areas and places that you can do liposuction on the face for. The actual cheeks are not a place that you can liposuction really. If you have kind of a round face or chubby cheeks, we do what's called a buccal fat excision. We remove the fat pad from the inside of the cheek to give you a more defined face and jawline. But if you have fat in the lower part of your face, like the neck or the jowls, That's definitely a place that we can liposuction.
What is the whole point of doing it while you're awake? Does it have any types of pros that being asleep doesn't
There's
have?
there's a slightly less chance of developing a blood clot if you're awake. That's something that's been shown without general anesthesia. Besides that, general anesthesia is very, very safe. Jazlynn chose to do this under local, and it is something that we offer. It's something that is becoming more and more popular. But if you'd like to be asleep and don't want to feel anything, you just want to go to sleep and wake up and be done, that's definitely doable here, and we have no problem doing that. No, stay right there. Okay, so we're just going to go from another angle. Okay.
Do you recommend getting testosterone to bulk up?
No, testosterone tends to kill fat.
Okay.
And build muscle. So testosterone would not help build fat. It would bulk you up, but it builds muscle.
Yeah, no, I'm never gonna take it like that. I would probably get some estrogen because that helps me gain.
Yeah, muscle mass burns fat. So testosterone is not helpful if you're trying to gain fat for a fat.
Okay, a lot of questions.
Let's answer them.
How do you get on the plane after a BBL?
You have to wait. We recommend that you take at least 10 days before you travel back if you're getting on a plane. That's for safety purposes as well as for comfort reasons. You can sit using a BBL pillow. It's something that, once you start your journey, we will tell you about. You will purchase it prior to your surgery.
For the trip, so how am I gonna be able to sit down comfortably on a flight? Oh, okay, so I'll be able to sit on it
You'll be able to sit on it, but also it's very important to get up and walk around on the flight every 45 minutes.
Okay.
So that's very important. And you're gonna want to do that. Okay, and I'm just checking to make sure that everything is nice and even and big. Okay, and we're going to turn the camera away for 1 second. You're going to turn to your other side towards me this way.
Okay. Is it still live?
Yeah.
Turn all the way this way. Good. Go to the middle.
I am 5'4" and I'm 129 pounds. Can I get a BBL? Send us your pictures and let's see.
Turn this way. Okay.
Y'all, I'm almost done, y'all.
Keep coming. Okay, a little bit more. Good. Arms over your head. Just one more second. Hold on. I'm going to replace that. Leg straight. Excellent. Good. Okay.
Okay.
All right. Stay right there. Don't move.
Can I get your hands up?
Yes,
You're going to come up there right now. Lean in this way. Excellent. Stay
fall?
right there. No, you won't fall. I promise.
Okay.
1 second. Not yet.
Just thinking that some of you you guys are outfitted and the freaking outfits are crazy.
Keep the camera up just another second.
Mm-hmm.
Okay. Positioned.
Will the skin tighten over time or become loose?
Great question. So, Jazlynn has great skin, no stretch marks, no previous kids, which a lot of our patients have, and no really big jumps in her weight, even though she gained weight for the surgery. So her skin should bounce back very, very nicely. There are other patients that we'll see, and they'll have some loose skin before the surgery, and we'll essentially warn them that liposuction can cause a little bit more loose skin. Some patients are okay with it. We have some skin tightening technology here that we can use to help tighten skin, and then obviously we also do excision of skin, where we remove some of the loose skin, and we can do that during or after your initial BBL.
This is a really good question. What safety precautions do you guys take as the surgeons take to prevent fatal complications? The only thing stopping me from getting my BBL at this point is the high mortality rate.
Great question. So there is a risk with BBL. Straighten out your legs for me. There's a risk with BBL as well as with any other surgery. So no surgery is without risk and without the possibility of complications. So the most common complications is bleeding, infection, those types of things. The things that we do to prevent bleeding, obviously, is the tumescent fluid. We use plenty of it so that there's minimal blood loss because of the epinephrine. The infection, what we do is we give you antibiotics before the surgery and after the surgery. And then obviously we preach about, hygiene and keeping your, showering every day and keeping yourself very nice and clean. And we do the procedure, under strict sterile protocol. And then the kind of most dreaded complication with this procedure is the phenomenon of fat embolism, which is what people are scared of, and rightfully so. So here's the long and short of fat embolisms with BBLs. It's been very, very much researched. It's been very, very much talked about, and then there's always a little bit of exaggeration and hype. Initially, the mortality rate that plastic surgeons thought came along with the BBL procedure, they believed that the actual number of fat embolisms and the actual mortality rate was a lot higher than it actually is. And the truth is that the mortality rate for fat embolism, or the mortality in general, for a BBL, is actually less than the mortality rate for, let's say, a tummy tuck. So those are the actual facts. And the way that obviously we avoid and do our absolute best is by understanding the anatomy. We only inject superficially above the muscle. I tend to inject from the top, and I don't inject really from the bottom, because the vessels that are of concern are more along the pelvic rim, which is kind of the area right between the buttock cheeks, and so we try to stay as far away from those vessels as we can. And again, just staying very superficial, staying above the muscle, staying right under the skin in the fat area, are all the things that we can do to make sure to decrease the possibility of any complications.
Are breast implants a safe surgery, and do you do breast augmentations at this location?
Yes, we do all types of plastic surgery at this location. Anything you can think of, we do it here. Cosmetic-wise, that is. Anything that's more of a reconstructive, we do at the hospitals. We do breast augmentations here. Breast augmentations are a very safe surgery. Silicone implants have been proven to be extremely safe and sturdy. During your consultation, we'll talk to you more about what it means to get a silicone implant versus if you would like a saline one, what the maintenance and the upkeep is for the implant, where we place the implant, and all those things. But it is a very popular, highly in demand, and safe surgery. But again, there is no surgery that carries no risk. So always keep that in mind.
How long does it take to recover from a BBL?
So there's the acute recovery phase, and that's the immediate recovery phase, and that usually is about 2 to 3 weeks. But to fully recover from a BBL and to fully see your results and to fully see the swelling go down and see the final picture takes up to 6 months. So there's kind of the acute recovery, which you start to be able to resume normal activity, go back to work, have really no more discomfort, just have to maintain wearing your compression garment and doing your post-operative lymphatic drainage massages. And then there's the more long-term recovery phase, which is just your body naturally healing itself and allowing itself to let everything settle, having some of the fat die off, some of the fat survive. We know that about 70% of the fat cells that we inject survive, and then 30% of them just get washed out and they don't find the blood supply, so they can't survive. And that whole process takes about 6 months.
Will the cannula touch my rib?
No, the cannula doesn't touch your ribs. The cannula stays above your ribs the whole time, but you will feel the vibration of the cannula on your ribs. You know, it's just a thin layer of skin and fat, but it's not touching the ribs. We would be in the wrong area if we were touching the ribs.
After the BBL, can you go back on HRS the next day?
We would recommend you probably waiting a week, maybe 2, to go back on HRT. But the next day might be a little too soon, but you can go back on it pretty soon after.
Is there any way to prevent breast implant illness?
Breast implant illness is really kind of it's a very broad and very not specific term. There are people that complain about just not feeling well after having breast implants. We can't really explain why. We're not really sure why. They come in and they have their implants removed. Sometimes they feel better, sometimes they don't. But it's a very uncommon phenomenon, and there's really no way to we don't know of a specific way to prevent it because we're not really 100% sure what causes it.
Do you do facial masculinization surgery? I'm asking for jaw and chin augmentation specifically.
Yes. Those surgeries are done at the hospitals. They're not done here at the office. But things like chin implants, genioplasties, those types of things are things that we can do.
So, for all pricing, you can click the link in our bio, or you can call our office, schedule a consultation. You can only get prices from a consultation.
Okay, go behind me. Good. All right, lean in this way. Excellent. We're getting there. You're doing great. This is the last side, and as soon as this side's done, we're going to do the transfer.
It's not that bad, literally. Am I okay?
You are doing great. Keep lying there. Take deep breaths.
Is there any alternative medications after a BBL besides medications that can get you high and cause you to be paranoid or hallucinate?
So, we have very good success with patients just taking extra strength Tylenol. So you don't have to take the narcotic pain medication. I think what you're referring to is probably the narcotic, the Percocet or the Vicodin, the medications that have codeine in them, like the oxycodone or the hydrocodone. And there are alternatives to it. Some of our patients, we can treat them with different types of pain medication if they have a poor reaction to the narcotic medication. We can prescribe gabapentin, we can prescribe tramadol, and like I said, a lot of our patients just do fine with extra strength Tylenol. It's generally not a terribly painful surgery or recovery.
Like you could put like with scraping?
Yeah, it's because it's right over the ribs and we're basically down to like no more fat. If I want to try to get as much as I can so that we give you the best transfer possible. But you're doing great.
Jazz, someone said, thank you for sharing this moment with us and we wish her a speedy recovery.
Excellent, that's beautiful.
Can you pin the color again?
Mm-hmm.
Just so like the girls could like see it if they just want to or not.
So if you are just tuning in, this is Lipo 360 and we will do the BBL after. Best way to not lose hips post-op, especially when you don't have that much elasticity in the hips as is.
Best way is try not to put any pressure on it and try to maintain your weight and don't lose any weight? That's a really good question. That's something that, you know, we do struggle with sometimes. Patients that have really no elasticity and really no hips. It's a difficult problem. We sometimes have to do multiple rounds of fat grafting. One time may not give the person the complete desired result. So a second round might be necessary. The other thing is just to make sure you maintain your weight. Eat plenty of healthy fats after the surgery so that the fat doesn't die off or the fat increases in the area where we've grafted. Okay.
After getting a BBL, will you always be susceptible to fat absorption, or is it more likely within the first few months?
The fat what?
The fat.
The fat will.
Will you always be more susceptible to fat absorption, or is it more likely within the first few months?
No, it's only the first few months. Whatever stays. It doesn't go away. BBLs are a permanent, therapy. They're not. They're not. It's not a temporary thing. Okay. This is looking very nice. Straighten out your legs a little bit more. Very good. Excellent.
Is this what Kylie Jenner did to her body?
I have no idea what Kylie Jenner did to her body. I was not in the room.
Can you go from a flat pancake butt to a Nicki Minaj butt, or will you have to go for a second round?
No, you'll have to go for a second round.
You gotta wait 2 weeks to see how the silicone reacts to your body.
No silicone. We're not talking about silicone. None of that.
Oh, I thought you guys were like pumping. That's all right. Let's do that.
I feel like such a plastic surgery wizard for asking all of these good questions. The surgeon has me blushing for real.
Good. That's great. Yeah. We like educated consumers.
Can you explain what the cannula is doing?
The cannula essentially is removing the fat. So you can see the end of the cannula is blunt. It's not sharp. And so that's, it's safer, obviously, or because it can't really go through the muscle or go through any of the other organs on the inside. And then the tip is hollow, and that's where the fat gets sucked into, and it goes down this tube and into our sterile canister, which is where we're collecting the fat to transfer. So that's what the cannula is doing.
Can you transfer fat from your body to your cheeks?
You can transfer fat anywhere, yeah, absolutely. Facial fat grafting is something we do a lot of. Absolutely. If you want to regain volume in your face, it's like a permanent filler.
Dude, I wish I could go over the lips. I need to go back down here for a while.
When going in for breast augmentation, can you go from a 32B cup and get 600 plus cc's implants, or is that too big?
600 might be a little too big. We really have to see how much of your own native breast tissue you have, and get an idea of what your breast width, your base diameter is, and then we can decide, what the maximum volume is that we can place. Guys, we are just about done with the liposuction part. The next part is going to be the fat transfer. Okay. We are not going to stay live for the transfer just because there's going to be a little bit too much skin showing. But please feel free to continue to, DM us or ask questions.
Alright, but we need to take at least one shot together so you can be like, you get surgery tomorrow if anything.
Yes, absolutely. And Jazlynn will continue to update you guys on her progress.
Yeah.
Thank you all for tuning in. And I'm sure that Jazz thanks you very much for your support.
Thank you guys so much.
Okay.
I couldn't do it without the support of the team.
You've done great so far. The next part is
recovery.
it's quick to transfer. It's not a terribly long process. And then you're going to go off to recovery. And that's it from all of us here. Any last questions?
Let's see. I'm active duty military. Do you think 3 months is good enough time to heal before returning to duty?
Definitely. We have a lot of military personnel. We have a lot of police officers, corrections officers that come in and do the procedure. 3 months is plenty of time to recover. Great question.
Will you show the results when you're done?
Absolutely. Okay.
Oh. Okay.
Next one with a big old booty.